Hi guys, my name is Cameron Mansuri, and today I'll be presenting a speech on parvovirus and how it's a very important issue that's causing a lot of concern in our community. So before I get there, I just want to ask you all first a couple questions. So how many of you have dogs? The dogs, you have a dog. Okay. How many of you have ever owned a dog in the past or a puppy? I'm sure you have. Yeah. Okay. So does anybody think that vaccines for dogs aren't necessarily so important? Okay. So vaccines are a really important part of a puppy's life. So imagine you have a brand new puppy and they're being diagnosed with a life-threatening disease in their first 6 to 20 weeks of life. So parvovirus is a very deadly virus that has taken the lives of over 1 million pets alone in the past year, according to the SPCA. So parvovirus is a relatively new disease. There's no necessarily cure for parvovirus, but there is, several treatments that are being studied and researched to help parvovirus in the future, to help it actually find a cure for it. So did you guys know that parvovirus has a 90% mortality rate in most puppies, which that's a very, very high mortality rate. So today I'll be talking about the treatment symptoms and overall, broad spectrum of canine parvovirus. I'll start with the beginning. It was first discovered in 1978, and it's known as CPV in veterinary terms. It's a worldwide pathogen all over the globe. You're going to see pets with parvovirus. One of the most common deaths, or one of the most common causes for deaths in puppies is parvovirus. There are 3 strains. There's CPV2A, there's B, and C. So those are the most common types that are seen generally. So within the first 2 years of this disease being discovered, it was spread completely worldwide. So the virus is very active today, and vaccines definitely prevent parvovirus. Distemper parvo is the vaccine that helps prevent this disease. So I'll talk about some causes. That's the actual cell itself. And then the causes are really, how it's transmitted from puppy to puppy is through feces. So if a pet is infected with, parvo and any type of feces gets around any other type of pet, they can definitely contract it. It's very, very contagious. So how would you know necessarily if your dog was infected? One of the most common clinical symptoms include vomiting, smelly diarrhea, and overall foul odor. Parvo does have a distinct smell to it. Bloody stool, lethargy, depression, overall just not wanting to do anything, acting completely dead and depressed and dehydrated. So the puppies can be leukopenic, which means they don't have enough white blood cells because their blood is going to other places of the body. So once diagnosed, veterinarians have to act very quickly in order to actually treat the parvovirus. The treatment, like I said, there's no cure, but there is a very high mortality rate, so vets have to act very swiftly to attack the parvo. But the steps that they do take, since dehydration is a big part of it, IV fluids, subcutaneous fluids, while the puppy's under veterinary care for a few days is the best way to treat it. And then usually the vet will prescribe some type of antibiotics to help prevent any further infection. So it really destroys the intestinal tract of the dog, eventually causing death. So with the help of research, vets and constant studies, parvo continues to be studied, daily, and hopefully we're coming to some kind of cure with it. Knowing the symptoms can help you guys in the future if you ever want a puppy to prevent it from happening. So I work at Banfield Pet Hospital, so I see parvo a lot, and it's a very, very sad disease, very quick, and puppies are so young, and it's not fair to them. So thank you. Does anybody have any questions?